Cardiology case study, best treatment for broad complex tachycardia. Welcome back to our cardiology case series. Today, we're discussing a clinical scenario involving a patient with a challenging cardiac condition. Let's dive into the case. A 50-year-old man presents to the cardiac ward with known poor left ventricular function. On examination, he has irregular broad complex tachycardia with capture and fusion beats at a rate of 150 beats per minute. His blood pressure is stable at 120 over 70 millimeters of mercury. Given this information, what would be the most appropriate treatment for this patient? Here are the treatment options. A. Amiodarone B beta blockers. C. Flecainide D. Lidocaine E. Verapamil. Let's go through each option to understand which one is the most appropriate treatment. Option A. Amiodarone. Amiodarone is an antiarrhythmic medication often used to treat ventricular tachycardias, especially in patients with poor left ventricular function. It is effective in stabilizing broad complex tachycardias and is safe to use in patients with heart failure. Option B. Beta blockers. Beta blockers are generally used to control heart rate and tachyarrhythmias, but they are not typically first line in acute management of broad complex tachycardia, especially in the context of a patient with poor left ventricular function, unless we are dealing with a rate-related condition like atrial fibrillation with a broad QRS. However, in this case, it's not the most appropriate initial treatment. Option C. Flecainide. Flecainide is an antiarrhythmic that is contraindicated in patients with structural heart disease or left ventricular dysfunction due to the risk of proarrhythmic effects. Therefore, this option would not be appropriate for our patient. Option D. Lidocaine. Lidocaine is another antiarrhythmic that can be used for ventricular arrhythmias. However, it is less effective than amiodarone for broad complex tachycardias and does not offer the same efficacy in patients with left ventricular dysfunction. Option E. Verapamil, a calcium channel blocker, is not indicated in this case. It can actually worsen outcomes in patients with broad complex tachycardia due to ventricular tachycardia, particularly in those with poor left ventricular function. Given the patient's known poor left ventricular function and presentation with broad complex tachycardia, the most appropriate treatment is option A. Amiodarone. It effectively manages this type of arrhythmia and is safe for use in patients with reduced ejection fraction. Thank you for joining us today. Understanding the right treatment options in cardiology is crucial for patient care. Make sure to subscribe to our channel for more case studies and clinical insights. See you next time.